Today we will discuss disorders that are associated with carbon skeleton degradation. In this lecture we will discuss very important topics of phenylketonuria, albinism, alkaptonuria. First we will start with phenyl alanine. There is a major enzyme known as phenyl alanine hydroxylase. It will hydroxylase phenylalanine to tyrosine. This enzyme needs a coenzyme that is known as tetrahydrobiopterin (THB). Mind it, it is not THF. THF is tetrahydrofolate. This is THB, tetrahydrobiopterin. If due to any reason this step is blocked and this arrow doesn't work, then it will cause a major disease known as phenylketonuria. It is abbreviated as PKU. This disease is called phenylketonuria, not phenylalaninuria. Why it is not called phenylalaninuria? The reason is when this step is blocked, but first we should know why this step doesn't work. Because there is an enzyme defect. That enzyme is phenylalanine hydroxylate. But rarely it can also occur when this coenzyme tetrahydrobiopterin doesn't may work or it can't be made by the body. Either of them will cause this disease. Now phenylalanine starts to accumulate in the body. Then there is a transaminase that works on it and takes off the amino group. Transaminase, they take off the amino group from amino acid. So this transaminase will take off amino group from this phenylalanine and it will generate phenylketones. That is why this disease is called phenylketonuria. Now, these phenylketones and phenylalanine can cause problems in the body, giving rise to many symptoms. The symptoms may be mental retardation. The child may have an IQ of as low as 50. Normal IQ is considered as around 100. So the child will have a lower IQ. There will be musty odor in diapers that is very characteristic of this disease. There may be microcephaly as phenylketones get into the brain and impairing the brain functions. It may also interfere with neurotransmitters synthesis. In this disease, if this disease is diagnosed early, because 5 units of IQ are lost per 10-week delay. 5 units of IQ is lost per 10-week delay. So it should be, if it is diagnosed in first 8 days after birth, then we advise a diet of amino acids low in phenylalanine. That should be around 10 to 20 milligram per kg body weight, and be careful that the diet should be low in phenylalanine. There is not no, because phenylalanine is an essential amino acid and it cannot be synthesized in the body. It has to be present in the food for normal growth. So we provide diet low in phenylalanine. Now this diet is advised for the first 10 years of life. After that, the patient may take normal diet. But there is a special consideration for female children, because when they grow up and get pregnant, special diet is then advised in pregnancy. that is also low in phenylalanine. Now, apart from this diet, the patient is also advised diet supplemented with tyrosine, because now tyrosine, that is a non-essential amino acid, becomes essential. So diet must be supplemented with tyrosine. Now the patient is also advised to avoid substances like aspartame, that is present in Diet Coke and Pepsi and is used as sweetener for diabetics, and this should be advised, the patient should be advised not to take these. Once tyrosine is formed, it undergoes a couple of steps to form homogentisic acid. But before proceeding to that, there is another important issue to discuss. Tyrosine can go into another pathway that is used to make melanin. This formation of melanin also takes two steps, and the last step that is taken up by the enzyme tyrosinase in making melanin. This enzyme tyrosinase can be genetically defective. When this is defective, it will cause a disease known as albinism. In albinism, skin has low pigmentation and it is very sensitive to ultraviolet rays. There is an increased chance of melanomas. Hair is also white. The ocular fundus shows hypopigmentation. Patient is photophobic. There is nystagmus and there is decreased visual activity. Now coming back to tyrosine, when homogentisic acid is formed, it sees another important enzyme. That enzyme is called homogentisate oxidase. It oxidizes homogentisic acid to make melyl acetoacetate. This melyl acetoacetate goes into the Krebs cycle, and if this enzyme that oxidizes homogentisic acid does not work, it causes a major disease that is called as Alkaptonuria. It is a rare disease but important, very important from examination point of view, and is asked quite frequently in the exams. Now when this enzyme is deficient, homogentisate oxidase, homogentisic acid starts to accumulate and it spills into the blood, and then it gets into the urine, and in the urine it gives a characteristic dark color that can be from blue to black on standing. In the urine, when urine is kept for some time, it starts to darken. The color may be from dark blue to black. Now there is very important differential diagnosis of the urine color. When the urine is dark, it is alkaptonuria. When the urine is pink, it is porphyria. And when the urine is brown or tea colored, it is hyperbilirubinemia. Please remember that. Now besides going into the urine, this homogentisic acid can go into the cartilage and it can give rise to other symptoms like ochronosis, that is the darkening of the cartilage. It also causes arthritis as it enters and gets deposited into the joint cavities and cartilages. Now we come to the diagnosis of the disease, how this disease is diagnosed. The urine of the patient becomes black on standing. That is accelerated by the exposure to sunlight and oxygen. ferric chloride test on the urine will be positive. Benedict's test is strongly positive. That indicates that alkaptonuria comes under the differential diagnosis of reducing substances in the urine. Now regarding the treatment, there is no specific treatment. Patient is advised to take low proteins, that is his protein intake will be minimal, and phenylalanine should be taken less than 500 milligram per day. This is the recommended dose because you cannot stop phenylalanine. It is an essential amino acid, so it is a must that it is required in a diet. It is an essential amino acid, so it is essential in the diet. Otherwise, that may cause problems. Now, this completes our lecture. Next time, we will discuss maple syrup urine disease and other diseases that are left.